Welcome to the Doctor's Corner with Dr. Kline and Janelle Elgaway.
Good evening and welcome to the Doctor's Corner with host Dr. Kline and myself, Janelle Elgaway. If you have a question for Dr. Kline on tonight's topic, which is diabetes, please call in to the studio line at 415-915-2291. You can also ask questions and listen and chat live with our audience on our new YouTube channel called The Doctor's Corner. Well, good evening, Dr. Kline. How are you doing this on this beautiful evening?
I'm just dandy.
Good. Before we talk about our main topic for this evening, is there anything new going on that we need to know about or to be informed about?
The Congress just passed the opioid law.
Okay.
It's 600 pages long, and we thought it was going to be helpful, and it looks horrible. It's horrible. They're going to try to, the government now is going to overtly try to cut people off their medicines who have Medicare and Medicaid. They're basically going to refuse to fill prescriptions over a certain limits. Remember, we talked about that before. The FDA is the only regulatory agency that can make rules about prescription drugs, cutting the dose, increasing the dose, or whatever. FDA has no maximal dose. So the CDC, voluntary, non-binding agency that has no mandate to do anything about prescription drugs, is being put to the forefront, basically trotting over the FDA. They are trying to usurp the FDA's authority. The sad thing is that it's in the law now, and so CMS or Medicare and Medicaid is going to pick up on it. So I don't know. It may have to go to the Supreme Court.
Wow.
I mean, this is so egregious that people are following the wrong agency. It would be like ignoring the energy department and the nuclear power, and you have a nuclear power plant, so you just get the agriculture department to make up the rules.
Right.
So that's one thing that's occurred this week.
Okay. What else is going on?
The other thing is the hunt for doctors has really picked up.
How so?
The Atlanta Federal U.S. Attorney's Office has made a list of doctors, probably compiled by CMS, and the doctors that are prescribing the most opiate pain medicine are now being sent letters from the U.S. Justice Department saying you're prescribing too much, and that's making the opioid epidemic worse. And of course, you can do whatever you want, but we're going to keep an eye on you.
Now, is this the same letter that you spoke of last week on the show, or is this different?
I don't know. With my short-term memory loss, it's hard to tell.
Your friend received a letter, and I believe you did.
Oh, no, this is a different one.
Oh, wow.
This is new. These are to Atlanta doctors.
Okay.
So you get a letter in the mail that you're prescribing too much, as determined by the Federal Drug Police and the U.S. Attorney's Office. Of course, they're all doctors, right?
Right.
But they just refer to the CDC guidelines that are not sanctioned by Congress to be doing this.
Right.
And they are ignoring the FDA that is sanctioned to be doing this. And the FDA says there's no such thing as prescribing too much. It's up to the doctor. And just because you're at the top of a list, then you get rid of that person, right? Now you got somebody else at the top of the list. And you get rid of that person. Pretty soon you're down to one person who, guess what, is at the top of the list. So you persecute them. Then you got no doctors.
Wow. Is there anything else going on? I think that's
no.
Okay.
Yeah.
Well, tonight we're going to focus on diabetes, myths, and misinformation out there. How do you want to start off with this?
We have a saying in medicine that the treatment should never be worse than the disease. And so when I was in training and learning about diabetes, and of course this was back during the Civil War, But when I was learning about diabetes, I thought, there's something wrong with this. People would have a certain blood sugar, and you would give insulin. And I said to my teacher, I said, well, how much insulin do you give? Well, we just kind of, from experience. And I thought, good Lord, what kind of disease is this? If it's a real disease, there should be kind of a fixed amount of insulin to use.
Okay.
But how the treatment became worse than the disease has to do with Elliot Jocelyn. Elliot Jocelyn was a Boston physician who took care of children with diabetes before there was insulin. The children had a short lifespan. You can't live without insulin, and children don't make any insulin. And basically, they put them on these horrible diets, and the children just died in front of them.
Wow.
So when insulin was invented up in Canada, and Eli Lilly started manufacturing it in large amounts because they wanted to get this stuff out, Elliot Jocelyn was given a batch of the first insulin, and these children started to gain weight and thrive, and they survived. So what got stuck in Elliot Jocelyn's mind? Insulin has saved this kid's life. Therefore, insulin is the treatment for the disease, and the blood sugar is the bad thing about the disease. If we just lower the blood sugar, the children will be fine. And that's, of course, what happened.
Now,
But it was... Go ahead.
Is that true? I mean, is there anything else?
That's true. But the blood sugar itself is only a symptom of the lack of insulin. The real disease was the failure of the child's pancreas to make insulin. But this was in 1925. They didn't even know that the pancreas made insulin. They were just in the process of discovering that.
Right.
So what they had is a child with high blood sugars, they give them insulin, and all of a sudden the child survives and lives. How can you assume anything else other than lowering the blood sugar did the trick? They didn't even realize there was a type 2 diabetes for many, many years, another 20 years.
Wow.
In which adults still making some insulin. So it became really a different disease. Type 2 diabetes, you make some insulin.
Okay.
So then they said, well, if you just make some, maybe we should supplement it. But they were only making the determination you needed some more based on the blood sugar.
Right.
So, but now we know, we're into the 1940s and 50s, and they've discovered insulin, and we have a lot more information. It's made in the pancreas because the little areas called islets are filled with special cells that make insulin. They're just kind of sitting on the pancreas. It's just sort of taking a ride. So then Elliot Jocelyn just started to adjust the insulin in both his type 1 and type 2 diabetics because he didn't know there was a difference. And he was actually pretty conservative. He used urines, which sort of averages your blood sugar. And then if it looked like a pattern or somebody gets sick, he would increase the insulin, he would bring it back down. So that was kind of the treatment. Then it in the 1970s, people started asking the question, do these medicines for type 2 diabetes, and these were the first pills that came out, do they really make a difference? People's blood sugar was lower, yes, but they were starting to have some bad side effects of these first medicines. So they said, maybe we ought to take a closer look at this. So they did. It was called the University Study, and it was done in the 70s. Lo and behold, they were shocked to find out that even though you lowered the blood sugar, there didn't seem to be an impact on the outcomes. Now, what are the outcomes?
What are they?
Well, if you go to the American Diabetic Association website, they will trump and thump and embellish the side effects of diabetes. You go blind, they cut off your legs, and then you have dialysis.
Right.
So what did that create? It created a fear of loss of vision and your extremities. What could be more horrible than a disease where you go blind and lose your legs.
Well, and here we go with fear again.
Here we go with fear again.
Yeah.
So what happened was people started saying, get that blood sugar down because it's obvious that's part of diabetes and it's causing all of these horrible side effects. So get that blood sugar down. Today, it's now $500 a month worth of medicine to get the blood sugar down. Used to be $50 a month. But they've got 10 categories of medicines now. Get the blood sugar down.
Right.
So is there proof? Remember, the university study said there was no proof. Then in the 90s, they did a couple of more gigantic studies. 10,000 people. It was called the Accord study. 10,000 people. And they did it very carefully, and they put half in a kind of, well, you just do whatever you want, and the other half was in what was called tight control.
Okay.
That meant you were checking their blood sugars all day long, get that blood sugar down, get it down, get it down, versus the group of, well, if it's real, real high, go ahead and treat. Guess what?
What?
No difference in outcomes.
Really? So, and that's because they weren't treating the symptom? Or
they weren't treating the real disease. They were treating the symptom.
That's what I meant, yeah.
Yep.
So what came out of that?
It's like
then?
if you have a brain tumor and you have a headache, so you treat the headache, it's not going to make the brain tumor go away.
Okay. So they figured this out. Then what happened after the Accord study?
Okay, then they did another big study in England. And it showed the same thing. But the zealots, just like the zealots today, started picking little pieces of the studies out and saying, oh, this really shows. But it didn't. If you read the study, they were just fibbing. The studies done in England called the UKPDS study. There were a whole series of them, very hard to understand and read, but basically they didn't show an improvement either. Now, these are type 2 diabetics. So one study that was done, the most famous of all, done out of Mass General at Boston, and Dr. David Nathan, was a study done in children with type 1 diabetes. And they gave the type 1 diabetes, who normally take insulin anyway, have to because they don't make any. They had a tight control group and a loosey-goosey group.
Uh-huh.
There were about 5,000 or 6,000. The study was designed well, except for one fatal flaw.
Oh, no. What was that?
It's called how you select your subjects.
Okay.
If you're going to do a study, you have to select them at random. Usually they put numbers in a hat and pull them out at random.
And what did they do?
What they did was they were so concerned that the tight control group would go astray, they only picked kids and young adults who they thought would be compliant and follow the rules.
Huh.
So now what does compliant mean? If you look back in the charts, compliant means a kid that's got steady glucoses, supposedly following the directions, but really didn't have a severe disease.
Okay.
The kids with their blood sugars bouncing all around had more difficult disease because they had more problems making insulin.
So what did this do to the whole study then?
Well, David Nathan said himself that what it did is it showed that the tight control was better.
Okay.
But if you read it carefully, it wasn't that much better. So anyway, David Nathan said this was probably the best study ever performed in the history of medicine. And then they applied this. These are children now with type 1. They applied it to type 2.
Okay. And what happened then?
And then they made the claim that the studies done in England, the UK PDS studies, that they were really massaging the data and making conclusions they really didn't deserve to make.
Uh-huh.
David Nathan said, aha, we've been vindicated. So we can apply our results to type 2. Now, also in medicine and science, there's a very important principle. If you're coming up with some new data, you have to replicate it.
Were they
What
able
happened
to?
with the Higgs boson? You remember that? The guy that won the Nobel Prize, and they found this Higgs boson. They were they had the data. They were sitting around waiting literally to the last day before their announcement for a second group to replicate the study. That's how science works. You don't run off and say you found the Higgs boson until you get a replication. Now, replication has to be done by a whole different crew, whole bunch of different scientists, and that's what happened, and that's why they were able to announce the discovery of the Higgs boson. The study done by David Nathan has never been replicated ever, so it stands alone.
So why even keep it if it's never been able to be replicated?
Because of the belief that insulin does its work by lowering the blood sugar. And because that was a Jocelyn premise, and Jocelyn was definitely the father of diabetes. He had 40,000 patients.
Wow.
He was definitely the father of diabetes. He's one of the few people that actually saw the transition from children with no insulin to children with insulin treatment. So it became woven into their fabric. And so they started to become resistant about changing their mind. There was some scientists out in San Francisco, MD, PhD, who did a study to show these don't work. They attacked him. I mean, these staid scientific journals you read in there, out there, this guy doesn't know what he's talking about, and on and on and on. It became really kind of a phobic kind of thing, a phobia where they are afraid of losing sight in legs, and so to avoid that, we'll do anything. And so lowering the blood sugar makes us all feel more comfortable. But what that's turned into now, and it hasn't changed, and it should have, but it hasn't changed, it's turned into a horrible treatment protocol for people with diabetes. Right. The treatment is clearly worse than the disease. People are hunched over their glucometers all day long, poking their finger multiple times during the day, sweating when their blood sugar goes up a teeny bit. It's all for naught, because no study has ever been done in type 2 diabetes to show any improvement in outcomes. Now, the outcomes can also be heart attacks, strokes, blindness, blah, blah, blah.
Right.
But so everybody's afraid of this. I would be too.
Yeah.
Well, it's very easy to buy into this. Hey, doc, you just control your blood sugar, you're going to be fine.
Well, and you see all these little gadgets they have for this, or all these new medications they have out for it. But like you're saying, that's treating more of a symptom kind of thing, or at least, going towards what they're wanting for us to understand or think that this is. But really, what is all this money going towards to the studies and everything like that? I think they said $351 billion a year they put towards it.
Well, yeah, the expense is large. There's a lot of type 2 diabetics. Mm-hmm. And in my research, it appears that probably a third of those people do not really have the disease. The disease is under the microscope, and it's been under the microscope since a famous book was written in 1966 called The Pathology of Diabetes. There is pathology, Virginia. You look under the microscope and you can see it. It's not the blood sugar. You can see what's going on. It's injury. The capillaries, of which are the tiniest blood vessels, leak, and they leak into enclosed spaces. And guess where the insulin-producing cells are? In the pancreas. Oh. They're in little, tiny, round, spherical, enclosed spaces.
So, is there anything? Is there any research being done on this?
No, because the wave of hysteria, it's really hysteria, because that's a kind of a fear-driven belief system not based on fact, is the same as we're seeing in opiates. Uh-huh. You talk to a person who's a diabetic doctor, as I've done, and you start to give them this information, and they stop listening. What? Nah, that can't be right. I say, well, what is the pathology of diabetes? It's elevated blood sugars. How do they become elevated? Not enough insulin. How come they're not making enough insulin? What's wrong?
Yeah.
I don't know. But if you control the blood sugar, you're going to be fine. And it's sad because this is one of the worst examples of the treatment being worse than the disease. You sit down at a dinner table and you start worrying about what you eat. Believe it or not, when I was at Stanford in the 1970s in the pediatric service, we just had a bunch of non-Boston diabetic experts, and they let the kids eat whatever they wanted.
And how was that?
And if you want to go to and of course, no child can go to a birthday party and eat cake. Now he has diabetes. Oh no cake for him. What kind of impact do you think that has on children? So what would happen if their blood sugars shot up over the normals? Nothing. Oh no, they would end up in coma, and they would have to go to the hospital. Same reverse logic that we see in opiates. People who go ahead.
CGF on YouTube wants to know, what did you mean by pathology?
Pathology is what you see under the microscope.
Okay.
Pathology is what actually causes the disease. The pathology of cancer is you take a little piece of the tumor and you look at it under the microscope. That's the pathology. The pathology is really what's causing the disease, and that's why pathologists, who are doctors just like me, but they've taken a little different training, are the doctor's doctor, because they help us to understand the mechanisms of disease.
Okay. We have a caller from area code 980. What is your name and what's your question?
Hi, this is Jessica.
Hi, Jessica.
And I have a two-part question. Someone that I love actually has diabetes. I love her very much. And she has a question regarding basically the payment of the insulin. She says after, I think she said in April, from January to April, she gets help from Medicare, but then it enters something called a donut hole, which I'm assuming you might know of, but she said it has to do with Medicare, and Medicare is very aware of it, that donut hole. She can't pay for things like her insulin, so it ends up taking her entire check from Social Security just to pay for her insulin and like her heart medication, and I think it was one other, her antidepressant. She said it takes all of her money. Is there anything that can be done in regards to that?
I think they're going to end the. I think they're going to end the donut hole. That's just some rumor that I heard. That would be nice. The other thing is to talk to the pharmacist and say, what's the cheapest insulin available? Believe it or not, the old-fashioned insulins that were cheaper, the manufacturers took them off the market so they could sell the high-priced stuff. The high-priced stuff doesn't really work a whole lot better than the low-priced stuff. And now the big thing is, if a person has started taking insulin as a type 2 or adult diabetic, they may not need it. Now that's pretty much heresy, and I'll probably be, visited by the AMA Goon Squad soon. But it's true. In my own practice, whenever I took a new patient on that was not type 1, that was a type 2 diabetic and on insulin, I just said, hey, let's see what happens if we take you off. And guess what?
What?
The majority of people I took off insulin as adults now, not children, as adults, their blood sugars dropped.
Really? Huh.
Yep.
Well, with her, she's been taken off before, and it's actually put her in the hospital.
All right, so she may need it. Yeah.
Good RX coupons, but she says that they won't even take. Something about those will not go with Medicare, and that the pharmacist would not even take those coupons, and I myself have never encountered that. Do you know of anything about that?
No, I really don't know the details of insurance companies and what they do and what they don't do, but having a chat with the pharmacist about, is there some other medicine I can use? And then you can go back to the doctor and say, well, the pharmacist suggested that maybe we do this. But part of the problem is that everybody's trying to drive their blood sugar too low, and so they use more insulin, so it's more expensive. And by the way, nobody's even set the normal blood sugars. How about that?
Mm-mm. Really?
The normal blood sugar for an older person is 260.
Okay.
Really?
260. So if 260 is normal, then what is the rationale for trying to lower it below 260? Normal is normal.
Don't know.
Well, what it is, it's the hysteria over the treatment in order to prevent those amputations and blindness, which, by the way, are way, way overestimated. The number of people who go blind is less than 1%. That means 99 people out of 100 are never going to have problems with blindness. And then, guess what? In the United States, the definition of blindness is 2,200, which is not that bad. If you go on YouTube and plug in 2,200, they'll give you a little video what it's like to be 2,200. So we overdiagnose blindness. How many people have dark blindness? It's very, very rare. There are some, but it's very, very rare.
Denise from YouTube asked, can you eat healthy plant-based diet and lose weight and the type 2 diabetes would get better?
No, that's a myth. Eating is pretty much, a balanced diet and watching calories. Does food make your blood sugar go up? Yeah, it does in everybody.
Right.
Everybody's blood sugar goes up. You don't have to worry about your blood sugar going up after you eat, but yet people are so phobic now about eating, hunched over their glucometers, checking every minute.
Yeah.
Even Elliot Jocelyn, with 40,000 patients, even after blood sugars became available, he just continued using the urines. Just watch your urines, and because it's an average, and he didn't get very excited. He didn't increase treatments very often in type 2 diabetics, but now it's become a cottage industry.
Right.
They're building a $2 billion plant here in North Carolina selling SL1 drugs, which are not needed. Hate to tell them that.
Is there any treatment to change the underlying pathology or no?
Well, there is not. It's a capillopathy, which means it's a pathological process of the capillary. They think that just doing the normal things you would do for anybody for heart disease, and that's statins, aspirin, the blood pressure pill lisinopril also has a little bit of a side effect, we think, of stabilizing some of the leaky capillaries, but that's been challenged. But one of the big things that's occurred is improved surgery for eye disease. When you get diabetic eye disease, they really are good now with their lasers. And so they are preventing a huge number of people with serious blindness. So that's an improvement. Kidney disease, there's not much of an improvement there. They think the lisinopril blood pressure pill can help with that a little. But basically, you're stuck with a genetic disease, just like we have with addiction. You have a genetic disease, and you're going to have it all your life. And the basic problems are going to always be there. And that's these leaking capillaries. You can even see them under your fingernails with a magnifying glass. You can see the leaking capillaries.
Wow.
And so if they leak in your skin, they leak in your brain, they leak in your arm, it doesn't matter. But if it leaks into an enclosed space where you make insulin, and guess what goes on in the kidneys? The little filtering units in your kidneys are in little tiny compartments. So the same thing happens. It starts to leak in there, and then it causes the death of these, they're called nephrons in the kidney. The nephron is where everything happens, where you filter your blood and you make urine, happens in the nephron. So you start losing these nephrons.
Why aren't they doing that then? Why isn't everybody doing it?
I don't know, because I'm one of the few people that holds this position, and if you tell your doctors this, they're going to come after me with pitchforks and torchlight parades, because this is so ingrained in physicians. You see, it's numbers. God, physicians love numbers.
Is it
90 milligrams, you know?
Is it about being right or wrong, or is it about money? Or both?
No, it's about belief.
Okay.
But the healthcare profiteers have glommed on to the physicians' strong beliefs about this. And like I say, 10 categories of medicines that will lower your blood sugar? Are you sure you need to lower your blood sugar? Maybe your blood sugar is staying within parameters. And like I say, in young people, the high blood sugar is 200 after you eat. Therefore, it must be normal. If it were not normal, everybody whose blood sugar went to 200 would have problems. So if there's really no reason to lower blood sugar below 200, and in older folks below 260, so why do it? Oh, you'll prevent blindness and prevent amputations.
Less than 1%.
And again, less than 1%. And also, the treatment for amputation is much, much improved. The surgeons are doing sparing, where they go in and they remount the blood vessels, and there's just a lot less amputations than there were before. Kidney disease, they're not really made much headway with that, but the number of people going on dialysis is less than 1%. It's very rare. And so people need to start asking, like the American Diabetic Association, okay, how many people are going to have dark blindness? That's the rule, dark blindness. That means you really can't see. And how many are dark blind in both eyes?
Right.
See, that's what people are really afraid of. Who wants to not be able to see? But dark blindness in both eyes is almost unheard of from people that I've talked to in the field of diabetes. So, people need to be apprised of the odds, and then they can decide. In other words, if it's less than 1%, you're going to go blind. And we have all these new techniques, so it might even be less than that.
Okay.
It's up to you. If you want to try to beat the odds by sitting around with a glucometer and worrying every time you go out to a dinner, then go ahead. It's okay, because we're not 100% sure, so you get to decide. And children, it's really bad. They're running these machines now, where they're monitoring their blood sugar every 2 seconds. The reason I'm really concerned as a physician scientist is if you overtreat, you're going to get low blood sugars. Low blood sugars are far more disastrous to your body than high blood sugars, because a low blood sugar and low oxygen are the two things that cause cell death. So if you're running around with a low blood sugar, you are killing cells. Now, what really worries me, and this is just my own opinion, is that if you've got troublesome cells anyway in the back of your eye, in the pancreas making insulin, and in the kidney, maybe the hypoglycemia is making it worse. Maybe you're actually accelerating the disease. So my patients, and my rule is never, ever have low blood sugars. But the zealots say, oh, that's just part of tight control. Not for me, it's not.
Justine asked, can a gangrenous gallbladder that causes severe pancreatitis cause a person to get diabetes?
No.
Okay. We have two callers. A caller from area code 918. What's your name and what's your question for Dr. Kline?
Camera. And my question is, hearing the things you've said makes a lot of sense to me, because I've had one doctor say, actually two doctors say, oh, you're diabetic all the way, not pre-diabetic, need to treat, giving me the insulin pins. I got sick as can be. Other two doctors said, no, it's not even high, you're fine. I was really confused. But I do have neuropathy, and so, of course, the first two said that's caused by the diabetes. So now I'm really confused in my feet, my legs and feet.
Okay, if you want to find out if you actually have the real disease, go to an eye doctor. I go to an optometrist, and they dilate your eyes and they look around in your eyes, and there's all the tiny blood vessels. It's like a little window into your blood vessel system. If you do not have diabetic eye findings, the chances are you do not have diabetes because it is so prevalent. It's the most common thing that pathology, something you can see, the most common pathology in diabetes is in the back of the eye. And they may be very innocent little things, but they show up. You can, the optometrist or ophthalmologist say, hey, you got diabetic eye disease. And so that's a harbinger of the disease. If you don't have it, then my thing is chances are you don't have diabetes. If you have it, chances are you do have diabetes. There are other causes of peripheral neuropathy. Yeah.
Thank you, Tamara. Caller from area code 219. What is your name and what's your question for Dr. Kline?
Hi, my name is Dawn. I had a statement and also a question for Dr. Kline. I had insulin-dependent diabetes since I was 6. I am now 53. I was around when they were doing the urine test with the Kline test tablets. Now, over the years, I've seen some progress in this here. Right now, I have the insulin pump with the sensor, and I believe if I would have had the insulin pump with the sensor years ago, I would not today have 2 amputated legs and be blind in one eye. The question I have is, what do you feel about the hemoglobin A1Cs?
Well, David Nathan actually published a study about hemoglobin A1Cs and the average blood sugar that goes with them. In other words, if you have an A1C of 10, what is your average blood sugar? And lo and behold, they started to cross over in each other's zones. In other words, you can have a blood sugar of 250 and have an A1C of 8 or 9. What does that tell you? Tells you the A1C is not very accurate, in spite of the fact that people love numbers. Doctors love numbers. The A1C is only a rough estimate of your average blood sugar. There again, you are assuming that blood sugar is the disease. So if your blood sugar starts to rise, as it normally does as you get older, your average blood sugar rises, the assumption is your disease is going to get worse. It's the other way around. People with serious disease have serious disease in their eyes and legs, like you do, and in their pancreas, where they make insulin. They don't make enough insulin, up goes the blood sugar. So you see, it's a universal attack on your body by these little capillaries that are misbehaving. And so the blood sugars rise as a result of more damage in your pancreas to what we call the islets or the beta cells, not the other way around. You see, it's so easy to do a 180. We see this in science all the time. We see it in addiction disease. 2 things related are causal. Well, you got to be careful. You need to turn the logic around and say, wait a minute, maybe it's the other way around. Do you know why type 2 diabetics are overweight? It's because they eat too much? No. It's a symptom of the disease. It's the other way around. So in your case, you've lost a lot, and whether or not you should stick to tight control is up to you and your doctor. I can't advise people on their individual cases. But my concern is hypoglycemia, and any doctor that passes off hypoglycemia as something that should occur, I'm sorry, I will disagree with that. Hypoglycemia and low oxygen are the 2 killers of cells.
Thank you so much.
Thank you, Dawn. We have another caller from area code 580. What is your name and what's your question for Dr. Kline?
You're asking me?
Yep. Hi.
Okay.
What's your name?
I want to make sure because I was kind of hearing 2 things. Okay, it might be too soon. It said on there that there would be questions from the opioid part.
Go ahead.
Okay, I don't know if I was too soon. Okay, so I am a chronic pain patient. I've had a few different surgeries on my back. I'm being considered that I probably have more than one autoimmune. I haven't pursued discovering that yet, but I've been under professional chronic pain management by board certified pain management provider for 15 years, taking 3 80 milligram Oxycontin a day. I had 30 milligrams of oxycodone for breakthrough. I have weaned myself off of that. I've been told, we have had a great go at it with you, but because of DEA, you're going to be pushed off. And so we want you to go see, it was an interventional pain management provider. We want you to go see the one that does more just the pills. And so I saw him, and in terror, he said, oh, well, what we'll do then, and I'm 57 and I have a variety of comorbidities, as I was just describing. We're going to just let you take Valium liberally, and then we'll put maybe a clonidine patch on you and just take you right off that. And then I'm going to, for 3 days, you are going to detox, and then you're going to go on Suboxone or buprenorphine. And then somewhere down the road, we might put you back on Oxycontin, maybe 20 milligrams a few times a day. And I was just stunned. I'm a retired Air Force nurse, and I'm so disappointed in the government and everything that's going on. I have an 11-year-old son, a husband. I'm just absolutely about to lose my mind. I don't want to go on Suboxone. But
No. You need to get out of there. That's negligent medical care. You need to file a complaint with the medical board and describe what you just described, and then you need to talk to a lawyer.
I called a lawyer. Do you know what he said to me? He said, "I'm not interested."
Yeah, it's hard to get.
Literally.
Yeah. Well, you need to find another doctor. It's negligent care.
I live in Oklahoma City. They're all doing the same thing. Do you know that my primary care retired a week ago? I didn't even know he was retiring. And I tried today. I called 15 different doctors. As soon as they asked the question, are you on narcotics? And I tried to explain that I'm weaning down. And they all say, well, we don't do that. Nobody with and I'm like, I don't even need you to wean me down, but nope, we don't do that. Or
you need to send an email to Deborah Horry, Houry, D. Horry, at cdc.gov. She's the head of the section that caused all this.
Okay.
And ask her.
I'd really appreciate.
Ask her what you can do. That you've been to 15 doctors. Give a little brief synopsis in your email, just brief.
I will.
And what can I do?
Well, I contacted the legislator as well.
Yeah, that's good.
I called.
Yeah.
I'm doing what I know to do, and I pay every bit of attention to what's on with you.
Yeah, we've got our faces pushed in the mud right now, and you just have to keep at it. And enough people send emails to Deborah Horry, who's responsible for all this, and ask her what you should do. And you can write the Board of Registration in Medicine in your state. Give a little brief synopsis, no emotional language. I've been to 15 doctors. Where can I find a doctor?
Okay. Very good. Thank you.
All right. Thank you so much for calling in. Did you want to, should we keep going with diabetes, or did you want to answer something more? Okay. We have been getting questions. If a diabetic has leg pain, I know we were talking about that earlier. What does that mean exactly? Does it mean it has to do with diabetes, or no?
Well, you see, everybody's so frightened and have been made frightened by the American Diabetic Association, who takes huge sums of money, by the way, from manufacturers of insulin. Their advice is leaning toward their donors. And so people are so frightened about losing their legs that I would imagine a lot of pain is pain of fear. You're so afraid awful thing's going to happen. But generally know that peripheral neuropathy, as somebody mentioned, is pins and needles in the nerves. And guess what? If you look under the microscope, the little blood vessels, the little tiny capillaries that are supplying the nerves, every cell in your body has to be near a capillary to get blood supply.
Okay.
Guess what? They're leaking. Now, the good news about diabetic neuropathy is many times it will improve on its own. Your body just, is able to fix it. There's a lot of treatments for, you can try the antidepressants and things like that. I find they didn't work that well. And this is so uncomfortable that I used to just treat it with the dread opioids. And it's funny, in 42 years, I never had anybody become addicted or overdose and die.
Mm-hmm.
So, these are wonderful, safe medicines. Having peripheral neuropathy is pretty uncomfortable. And so if those other things don't work, and in this case, it might be worth trying, the anti-convulsants and things like that. Usually drugs in low dose will help with this.
Do you know if insulin makes diabetics gain weight?
Yes, it does.
Does it really?
Yeah.
Like a huge amount, or?
Well, whenever I see a diabetic on insulin who's gaining weight, guess what? You're taking too much insulin.
Huh.
If you're taking the exact right amount of insulin, you would not be gaining weight because as you eat a donut, you're not storing it, because insulin also is in charge of storing. Insulin is also in charge of converting carbohydrates to fat. So if you have just the right amount of insulin, you're not going to gain weight. So if you're gaining weight, you've probably got low blood sugars and you're getting too much insulin.
Okay. Do you know what snacks would be best to eat if you're diabetic? Because a lot of earlier they were talking, people are asking if there's any like sugar snacks that they can eat, because I guess they love that, and they wanted to continue, with something, but obviously, they want to try to take care of themselves too. Is there fruits or what?
You eat what you want.
Really?
Yeah, it's all about calories. Your body is, I think we talked about this before, is not stupid.
Okay.
So in other words, if you want to eat lean roast beef the rest of your life, it's just going to turn it into glucose in your body.
Okay.
If you eat donuts all the time, the extra glucose in your body is going to be turned into fats and contribute to the energy for making protein. So, if you're worried about your blood sugar, if it's sustained for a long period of time, then maybe you should eat less. If it just goes up temporarily, so what?
Yeah.
But it goes back to glucose being poisonous. If you believe that glucose is poisonous, you're stuck.
Okay.
And the rest of your life, you'll be hunched over your glucometer, where the treatment becomes worse than the disease and will become very expensive, because everybody leaps on the newest drugs to lower your blood sugar.
Right.
My personal view, and the way I approach my own patients, is if you are a type 2 diabetic, irrespective of what your complications are, you follow not the blood sugar, but you follow a serum ketone. Now, Jocelyn used to use ketones in the urine, and any of you diabetics been around a long time, you would monitor your urines for ketones. Ketones are the alarm klaxons. You should never have ketones in your blood.
Now, doesn't the body go into ketosis, though?
Well, ketosis is poisoning by ketones.
Okay.
And you should never be that way. The Atkins diet was making people starve themselves so they got ketones.
Well,
That's
now they have the
normal.
ketogenic diet, which I kind of like, actually. I'm not diabetic, though. But it's, high protein, low carb, low fat.
So if a diabetic is worried about their real physiology, in other words, what's really going on in that cellular furnace, there's a handy way to find out.
How's that?
Serum ketones.
Okay.
In other words, if your blood sugar is 400, and I've had several patients who couldn't get their blood sugars below 400, I think that's just the nature of their disease. But we would check a serum ketone. If the ketone's normal, then you haven't got anything to worry about.
Okay.
If your ketones will become positive on both ends. If you have low blood sugars, it'll become positive. And if you have high blood sugars associated with ketoacidosis, that's when people get sick, you're going to have ketones. So if you do not have ketones, relax. Now, the doctors will all want to shoot me and say, oh, yeah, but that doesn't count for the high blood sugars causing complications. But you have to believe that high blood sugars do cause complications, and I do not believe that based on a review of diabetes I did 2 years ago with 3,000 papers.
And what was the outcome of that?
Outcome is that it's not the blood sugar.
Okay.
So these, by the way, these little ketones, you can buy them. You can buy ketone strips. They're $5 each.
Okay.
And you buy a little meter. There's a couple of them available. Precision makes a glucose meter and a ketone meter. And you can look online for serum ketone strips. So you prick your finger, you get a reading, and I've found in all of my patients it's very, very accurate. In other words, if you stay below normal, you're fine. And if in the morning when you're hungry, it might go up a teeny bit. But anytime those things start to go up, either you're short on insulin or you're getting too much insulin. Either way, it tells you something's wrong, which is really, in my view, pretty nice.
Okay.
Because if it's not elevated, then you can say, I can relax. I don't need to do my blood sugars 10 times a day. And you know what? Most diabetics can tell when they feel bad anyway. This thing of doing blood sugars all day and counting calories, in my view, in my treatment of patients, I do not do that. I would much rather them have a nice life, especially since there's no evidence that it's going to improve these disastrous outcomes. You just have to take a chance with disease. You know, I mean, people have high cholesterols, they've got an increased chance of having a heart attack. You know, so you just got to put up with that. So and then you do what you can, which is, aspirin and statins and maybe using lisinopril to get at the basic problem, monitor it with serum ketones, and forget about the blood sugars. You know, most people will not be able to give up doing them, but if you do a serum ketone at the same time.
Can a menstrual cycle and or going through menopause affect glucose levels?
You know, it's funny, when I was in medical school, I never forget the professor standing up there and saying, serum glucose is subject to every imaginable thing in your body. Hormones, being sick, what you're eating, drugs. It's just a very, it's got a lot of things controlling it. And certainly, estrogens and progesterone, can fluctuations that women have can certainly cause fluctuations in blood sugars. In men, because testosterone does not fluctuate, usually the blood sugars are more stable.
Okay. People are a little bit confused. They want to know the ketones, the vitamins that you can buy at the store. Are you talking about the same thing as keto? How do you say it? Ketoacidosis.
Yeah. Ketoacidosis is when a person goes into coma.
Okay.
And they're not getting enough insulin.
All right.
And they go into the hospital, you have to give a whole lot of insulin, and they're sick, and IVs, and during that time is when your serum ketone levels are the highest. When your furnace cannot burn sugar because there's no sugar available, either you're not getting enough insulin and you're sick, or you're getting too much and you're driving it down. The furnace then goes into this emergency mode where it starts to burn your fats as the primary energy source. So it's kind of like if your car ran out of gasoline, you can run your car on kerosene, but it doesn't run real well.
Right.
You get a lot of smoke and stuff. So when your body is burning fats, it generates ketones. So what that's telling you, you are in emergency energy. Your furnace is now running on emergency mode, and that's not normal. And so whenever you're running on emergency mode, you see ketones in the urine, you see ketones in your blood. Something's wrong with the furnace. And the furnace that generates energy and your breathing are the two things that keep you alive. So when that ketone shows up in your blood, something's off.
Okay, so these are different then.
Yes.
Okay. All right. Do diabetics have to be on insulin the rest of their lives? And why can't they take a pill instead?
Okay, it depends on which type you have. If you have type 1 diabetes, starting in childhood, as the lady that called in before, you make no insulin. All the little islet cells are all killed. So yes, for a type 1 diabetic, you have to take insulin the rest of your life. People with type 2 diabetes, I think there's, in my experience and based on my research, I think there's very few type 2 diabetics that need insulin. You call into the doctor's office, my blood sugar was 310. That's not so bad.
Yeah.
But I'll tell you, it brings sweat to the brow. Oh my God, 310? You need insulin.
What is a dangerous level?
There is no dangerous level unless
Okay.
you're sick.
Okay.
It's very unusual to see blood sugars over 300. Maybe the low 300s, like 325. But I have two patients. One had persistent blood sugars of 400. She was perfectly fine. And we tried to give her insulin, and she crashed. So we just backed off.
Mm-hmm.
And I had another lady. I did a house call. She was a farmer. And she came to the door with her walker because she's older and stuff. And we sat down and talked. And we said, well, let's just get some blood sugars. And so we pricked her finger, and her blood sugar was 700.
Wow. Did anything
So
happen?
she was fine. And we did the same thing. We thought, well, we got to get this down, right?
Right.
We
Right.
got sucked into the whole thing. And every time we tried to get it down, it made her worse. So we just left it alone. She wasn't urinating a lot. She didn't have serum ketones. That's the first thing we checked.
Mm-hmm.
So we knew that her furnace was working okay. And so we just left her alone, in spite of the fact it was driving us nuts, because you see, we're all brought up in the Jocelyn method, get that blood sugar down. But those were two good examples of people that were fine. Neither one of them had diabetic eye disease, by the way, which is my criteria for real diabetes. We sent them to the eye doctor with nothing, So they just had isolated high blood sugar. And I think a lot of people that get into these diabetic clinics and stuff are in that group of people that just have high blood sugars, and that's why they should all go to the optometrist immediately. And if they got a negative eye exam, my patients don't go on to treatment. That's
Okay.
just my patients. This is very, very different than 99% of the practice of diabetology that currently exists. But I have read enough papers and done enough research and also observed my own patients that I am 95% sure.
Do all diabetics have to see an endocrinologist?
No.
Okay. But you should see an optometrist.
Should go see an optometrist.
Okay.
And I'll tell you, if maybe even once every 6 months, what the heck, let them do it. It's called a dilated eye exam, where they dilate your eye so they can really look around. And I like optometrists because they don't do surgery.
Right.
And they're very, very, my optometrist that I go to, he's probably looked into 20,000 eyeballs. So in other words, he's seeing a lot more eyes than an ophthalmologist, the surgeon, the doctor, MD doctor would. So I like optometrists because they have more experience.
Okay. Well, we're going to wrap up here. Did you want to leave us with any words on tonight's topic?
Well, keep in mind that this is my personal view, but it is based on data. I'm just not making it up. And I think, reading up yourself, looking up things, most of the stuff you're going to read pretty much fits into the standard American Diabetic Association, but you can ask them questions. How many people go dark blind in both eyes? How many people actually have to go on dialysis? How many people really have an amputation of their leg? Start getting the data yourself. See, then you can make your own decisions, about what you want to do with your tight control, and how much you want to struggle and ruin your life. I mean, if I know people whose lives are nothing but centered around control. That's an interesting word.
Uh-huh.
Control. In medicine, we don't control people's lives, or we don't control their disease. We work with patients to do what they want to do within the framework of science. So, if somebody says, hey, I want to go loosey-goosey here and I'll just keep an eye out on my serum ketones, there's not a lot of doctors that are in the know that could argue with that. And by the way, the Jocelyn Clinic in Boston, for their children's services, they use serum ketones all the time for children with diabetes. And there it's even more important because these machines that they're paying $20,000 for, pumping insulin into your body, which is handy because then you don't have to do it so often, but they frequently overshoot. There you go with your hypoglycemia. They're trying to make them so that they don't do that, and they are getting better, but they're pretty expensive. It would be nice if you could just relax and let it kind of take over, and they may be getting close to that point of accuracy where they're preventing hypoglycemia, and then it's fine. But, if the treatment of the disease is worse than the disease, people with diabetes are perfectly okay. They're not sick. They don't have any symptoms. What they're trying to do is prevent things that are going to happen 30 years from now. But people with diabetes are in perfectly good health. Run around, do whatever they want. Got to be careful about those low blood sugars. But aside from that, really, kids with diabetes are in perfectly good health.
Mm-hmm. What will the topic be for next Tuesday?
Next Tuesday, I thought we would talk about fear of addiction, phobia, and about phobias, and about answers to questions that we all keep asking ourselves. Why are they doing this?
Right. Well, if anyone has questions on tonight's show that we didn't answer, or has a question for next week's topic, fear of addiction, please get in contact with myself or Executive Assistant Jess Stewart. Well, thank you, Dr. Kline and audience, for taking some time out of your evening to join us here at the Doctor's Corner.
Good evening, and thank you for inviting me.
All right. Well, have a great evening, Con Nation, and thank you for joining us.
This has been The Doctor's Corner with Dr. Kline and Janelle Elgaway. Copyright 2018. All rights reserved.